Good morning. Hello, I'm Dr. Jyothi, Senior Consultant for General Pediatrics and Pediatric Rheumatology at Aster Women and Children's Hospital, Whitefield. And today I'm here to just give a brief talk on understanding childhood arthritis. What do we mean by arthritis? Arthritis refers to pain, swelling, stiffness of joints. It can be acute or it can be chronic. And by chronic arthritis, we mean something which goes on for usually more than 6 weeks. And when arthritis affects children below the age of 16 years, it is called as juvenile arthritis. And this may be due to any number of reasons. It may be due to infectious causes. It may follow infection, what we call post-infectious causes. It may be due to inflammation in the joint, or it may be due to non-inflammatory causes. It is important to rule out serious or sinister causes of arthritis, such as a malignancy. Once all these causes are excluded, then we do diagnose autoimmune causes of arthritis and what is typically termed as juvenile idiopathic arthritis. Juvenile meaning in children, idiopathic meaning where the cause is not known, and arthritis refers to pain, swelling, inflammation in the joint. So juvenile idiopathic arthritis has many types. Some of the types or the classification by International League of Association for Rheumatology are as follows. Systemic arthritis, where the arthritis comes with fever, with some skin rash. There may be inflammation of the joints, of the linings of the body, such as the heart lining called the pericardium, the lining of the lungs called the pleura, or the lining of the abdomen called the peritoneum. There may be lymph node enlargement in these children. There may be swelling of the liver and spleen along with arthritis. The next type of arthritis is called oligoarthritis, when the number of joints affected are less than 4, 1 to 4 joints are affected. This is called oligoarthritis, or what used to be called earlier as polyarticular juvenile idiopathic arthritis. And while this form of arthritis is more common in the West, we do see it in our country, but not so commonly. It typically affects the preschool child, and the child who is too young to complain of pain may actually come with a limp, or the parents may say that they have noticed some abnormality in the gait. This may continue to remain as persistent oligoarthritis when the number of joints affected are less than 5, or after a period of 6 months, if the number of joints affected become more than 5, it is called as extended oligoarthritis. The next type of arthritis is called polyarthritis, where the number of joints affected in the first 6 months of onset are more than 5 joints. And this may be seen either in young children or it may be seen in the older adolescent children. So arthritis, especially juvenile idiopathic arthritis, is more common in girls when compared to boys. However, there is one form of arthritis called enthesitis related arthritis, which we see more commonly in boys older than 6 years of age, and they come with a lot of pain and swelling and of the joints, especially of the lower limbs, with difficulty in walking, night pains, sometimes fever. There is psoriatic arthritis, which may come when there is a family history or a history of psoriasis in the child. Psoriasis is a skin condition which causes red and thickening or thick skin along with silvery scales on the skin. These psoriatic lesions may be there anywhere on the body, and psoriasis predisposes to arthritis. In children, the arthritis may begin first, and the symptoms and signs of psoriasis may be seen many years later. Hence, it is important to elicit a family history of psoriasis. Typically, children with psoriatic arthritis develop swelling of the fingers, the digits, what is called dactylitis. There may be some conditions, some children may present with certain symptoms which do not fit into any of these types of arthritis, and that is called as undifferentiated arthritis. So it is important to be aware that children have a whole range of treatment options available. This condition can be controlled and children can grow up with a normal quality of life like peers without any deformities. So if you know anyone who has this condition, please feel free to visit us for further information. Thank you.